Hello, everybody. Welcome to the Provider Relief Funds Reporting Update webinar for June 16, 2021. My name is Mark Lynn. I'm a CPA from Chattanooga, Tennessee, and thank you guys for attending today. We've got a great turnout. A lot of people wanting to learn about Provider Relief Funds. So Danny Gilbert will be with us. She'll be the technical person that can help you if you have issues. We do have the slides over in the corner over here in the handouts. If it doesn't download, it's just another GoToWebinar issue that we typically have. The registration links work about half the time, and about half the time the handouts work. But I did email those to everybody that was signed up as of a certain time this morning, and I did put it on our website at the RHC at ruralhealthclinic.com. I put it in the Facebook group as well. So there's lots of places where you can get the slides, and we will send out an email to you guys tomorrow with the recording and with the slides as well. What do we do this time of year? We prepare cost reports at 24 hours a day, 7 days a week. And Julie Quinn is with us as well. She's going to be a panelist here, sort of a last second thing. But and thanks to Julie for doing that. So Julie and I are just doing cost reports. I think that's pretty much 24 hours a day, 7 days a week until August the 2nd, which reminds me, if you don't have your cost report stuff in to us or to Julie or David James or whoever's doing your cost report, get that stuff in, because Julie likes to go to Orlando and enjoy her time down there. I am going to Maine, so we're probably going in opposite directions, but everybody has vacations, and as much as we like to have the extra 2 months to do the cost reports, I think I would rather get them done in May and get them done with and enjoy our summer. Julie, is that sort of your thinking as well?
Absolutely, as soon as possible.
Yeah, so I would rather get them done now and get them into us quickly so that we can get these things out the door, because we don't want August 2nd will be here before you know it. I saw one, I think WPS said that if you got it in by August 9th, they wouldn't cut your payments off, but we don't want to be relying on that. We need it and get it as quickly as possible. What I've been doing since the pandemic started is, instead of full-time cost report preparer person, I've been mainly a librarian of sort of keeping up with all the different rules and changes and trying to keep up with the best I can, and a traffic cop. As a traffic cop, I have been sending a lot of traffic towards Shannon Chambers over the last week about that $100,000 that a lot of you guys got and a lot of you didn't, and Shannon is going to tell us a little bit about that. I'm going to have her bio up just in 1 second. And Elizabeth Burrows, a lot of stuff has been going to her this last week because of the grant, the Vaccine Confidence Grant that RHCs are applying for by June 23rd. So I've got two of my best people where I've been sending lots of questions from you guys too over the last couple of weeks. If you've not become a member of the RHC information group on Facebook, please do. We're up to about 2,500 members, and it is a really fantastic resource with lots of great consultants and lots of people that will help. I said Shannon, Julie Quinn, Patty Harper, a lot of people really, Charles James, a lot of people, Nathan Boz on there. There's a lot of people. I even saw Bill Fennerfrog was posting the other day. So Bill's coming over to the dark side a little bit. But it's been extremely helpful and just a great way to get information out very quickly and help you guys get through this. Here's our website if you need to go to it, and if you're looking for our slide presentation and the recording, this is where it will be, at the ruralhealthclinic.com COVID-19. So look for all that there if you need it. If you have questions, just put them in the question box over there. Danny will monitor that for you. Looks like I'm looking over there. It looks like there's a question already. Danny, can you tell me what that question is? Is it something related to sound or anything like that?
No, it's a cost reporting question.
Oh, cost reporting question. Okay, all right. We'll worry about that later then. Okay. Let's see here. And then disclaimer, I try to have everything up to date as of today. This CMS or HHS provider relief funding information changes like the weather in Tennessee. It really does. So if you don't like it, just wait 5 minutes and it will change. That's been sort of what's happened over the last year or so. We're hoping it will change again. I'm going to show you an email from the National Rural Health Association where we're trying to get some last second changes to these rules, because it was sort of a dirty trick to tell everybody that here's the rules released on July the 11th, and you have to have everything spent by June the 30th. And for rural health clinics, that's pretty much what the rules stated. Now, it says that there was an extended period of time to spend it, but the way the periods worked out, 95% of the monies that the RHCs received was during that first period, and thus had to be expended by June the 30th. So it wasn't really much of a reprieve for RHCs. We'll talk about that when it's my turn to talk. Of course, Shannon Chambers is here with us. I've known Shannon for probably a lot longer than either one of us would like to admit. And she's been doing a fantastic job with the South Carolina Office of Rural Health Clinic for a long, long time. She's on the board of the National Association of Rural Health Clinics and does a lot of work behind the scenes, and a lot of work on the COVID-19, the testing, which the NARHC took over. They had an agreement with HHS to provide this service for that 49,000 that you got last year and this 100,000 that you got last week, hopefully. And if you didn't, Shannon will know what the status is of that. So Shannon's doing fantastic work, and then Shannon will be talking first. Elizabeth Burrows is the attorney that we've been working with on getting the grant applications for the Confidence Grant. So and I've worked with Elizabeth now for many years as well, and I send her all the grant work, all the FQHC work, and oh my goodness, she's been fantastic. And both Shannon and Elizabeth have been extremely responsive to the needs of RHCs, whether you're their clients or whether or not. Shannon's based in South Carolina. No matter where you are, she's been very helpful to you guys. So it's been fantastic. There is the schedule. Shannon will talk for about 10, 15 minutes, whatever time she needs. And then we'll stop and take some questions for Shannon, and you can type those in as you go along. And then after that's over, Elizabeth will talk for whatever time she needs just to give you an update on that grant funding. And then whatever time left, I will go through these provider relief funds, basically trying to tell you what you need to spend or what you need to document by June 30th. That's really what we're going to focus in on this webinar. We're not going to talk about how to do the reporting because the reporting portal is not even opened up yet. It didn't open until July 1st. So we will go over that. Julie Quinn is here with me. So if I get derailed or if I go down the wrong path, Julie can help me get on the right path for that as well. So that's all that I have as far as introduction. Shannon, I'll turn it over to you and go for it.
All right, sounds great. So wanted to talk to you a little bit today. So rural health clinics received the $49,461.42 back on around May 20th, if you were in the first wave of payments. So as a reminder, those funds have to be spent out by December 31st of this year, 2021. Additionally, the payments of the $100,000 per rural health clinic started depositing into accounts last Thursday. In order to be eligible for those $100,000, one, you had to be on QCOR, which is CMS's system. So if you were one of our newer rural health clinics, it doesn't mean that you're not going to get funded. It just means that your information was not on QCOR by around the middle of April. In addition, if you had registered and reported for the funding that you received, the first round funding, the $49,000, and have done that by the middle of April, then you also would have been eligible for the $100,000 that you should have received. We are hearing that there's a little bit of delay with some people's banks. It seems to be 2 banks in particular that I've heard so far. So if by chance you have not received it, please wait just a few more days. If you feel like you are eligible and you should have received the payment and something weird is happening, please reach out to me at the beginning of next week. I'm going to give you my email address. What I need from you is to tell me how much you were expecting. So again, if you have 2 RHCs, I would need to know that. And by TIN number. So meaning, if you have 2 rural health clinics and they have 2 separate TIN numbers, then I would need that information to be able to track on the payment attestation information. I've heard from a few. Out of all of the payments that were sent out from HRSA last week, which you can actually pull the state breakdown, there were about 4,200, a little more than that, rural health clinics that receive funding. Only about 50 people are receiving paper checks. So if you are one of those folks that received a paper check the last time, whether that was in the first round back in May 20th, there were additional payments that came throughout, then you would need to, sorry, saw the chat, totally got distracted. Then if you receive that by paper the first time, then you're probably going to receive a paper check. So a lot of our pediatric clinics, we may not have payment information because of course we don't bill Medicare all the time, right? So you may not have that information updated. If by chance you had a change of ownership or something else that's happened, go ahead and reach out to me and let me go ahead and get that tracked. We want to remember that as long as there is additional funds available, they are looking to make that second payment for those that have not been previously paid. That will be in late summer. We already have some on our list that maybe came into QCOR. I know Mark's been sending some over to me. I have some that came into the program at the end of March. Of course, you would not have been on QCOR's system by the middle of April. We just know it takes a little bit longer than that. So then I've already got them ready. Looks like they're ready to go for the next round. So with that, I do see someone asked a question regarding the $49,461.42. That does have to be completely spent out by December 31st of 2021. So you have a little more than 6 months to get that taken care of. If you have questions on how those funds need to be spent, please reach out to me. We have to remember that that first round of funding was for COVID-19 testing only. It's COVID-19 testing. Our new $100,000 funding is COVID-19 testing and mitigation. Mitigation can mean a whole world of a lot of information there. So as we're going through that, HRSA has some frequently asked questions that will be posted very, very shortly. So we've seen the draft as part of the project team. We're trying to get those out to you just as soon as we can. If you have questions on how to spend that for mitigation, there are going to be several opportunities. Please don't automatically turn around and send the funds back. This is not just COVID-19 testing. The mitigation is going to be the biggest part of this. It has some fantastic opportunities for you to do some things within your clinic to make sure that we're working on infection control, or maybe we're working on digital health. And there's a lot of other things that are coming out as part of that. The terms and conditions are already out and available on the website. So if you were to look up COVID-19 testing and mitigation, you will find it very quickly. You do have to go in and attest for the funds. It's the same process as before. So where you attested for the first $49,000 under the COVID-19 Link Health website, and Mark, I'll drop that into the chat for Danny to make sure that gets to y'all as well. You will have to go in and attest for those funds. If you do not attest within 90 days, HRSA, Federal Office of Rural Health Policy, that you have actually agreed to those terms and conditions. We've had several people already reach out and say, nope, I'm sending the funds back. I'm like, hang on just a second. Let's talk through how you can actually start to spend those funds. You have, for this $100,000, you have until December 31st of 2022. It also goes back and retros back to January of this year. So if you already spent all your $49,000 and you still had expenses from January to June, fantastic, you can apply those. You do want to make sure that you're following the same process. If you were to be audited, you're going to want to have that information, whether that's an Excel spreadsheet, whether you create a different account into QuickBooks as a company or however you want to track it, whichever way you're doing it, Excel is fine. If you were doing PPE, then, and you spent $3,000 on PPE for COVID testing, great. You're going to book that in. You're going to tie it back to the grant. You just want to be able to track that information. If you have additional questions, I'm here to help you. I say that, I mean that. Most of you that know me know I will get back to you and we'll provide some answers, even if it's 11, 12 o'clock at night. I think Mark and I were emailing at 3 o'clock in the morning the other morning because something apparently is wrong with us. But I'm going to stop there if there's additional questions. So in just a second, I'm going to send those over to Danny, the link for where you actually will go in and attest. So I'll make sure she gets that to the full chat because I can't. And then I'll also give you my email address that's tied back. You will see I'm on currently, yes, I work for the South Carolina Office of Rural Health. I'm currently on contract as part of the National Organization of State Offices of Rural Health. So you will see an email that looks a little different. Again, if you have my email here at the office, either one is fine. I currently have access to about 5 different emails. We are getting it done. Again, thanks for your time. Mark, thanks for letting me have a few minutes of your presentation today. And I'll send that information along in the chat in just a second.
Okay, thank you, Shannon. And she's absolutely right. She so responsive, even at 3 o'clock in the morning. We are getting things done at all times of the day. So thank you for being such just a blessing to the RHC community. It really has been fantastic. So let's look through the questions here real quick. I think we covered most of them already. Everything, the initial 49,000 had to be spent by 12/31 of 21 of this year. The 100,000 has to be spent by 12/31 of 22. So we're good to go there. The website is off the top of my head, rhccovidreporting.com, but you're going to give that to us, and so that one would be good. We do have a real quick question. I'll let Julie handle this. I don't know if Julie can see the questions or not, but it says, I'm new to RHC cost reporting. I'm a pediatric clinic and don't bill to Medicare. But do I need to send in some sort of statement for this as far as cost reporting goes? We don't intend to bill Medicare, so I'll let you take that one. That's a nice little softball to get us started on there.
Right. So you're talking about just a cost report? Do I have to do a cost report?
I was just thinking the no utilization cost report.
Yes. So it's more than just a statement. You actually have to fill out the first few pages of the actual cost reporting form and send those in with hours of operation, just a little bit of information for them. But yes, you have to do that every year or they will deactivate your number. Yeah,
so yeah, just Deb, if you'll just get a hold of Julie or myself, it's very cheap. It's a very inexpensive thing. It's not like a full-blown cost report, but you do have to have access to the cost reporting software in order to sort of create the documents they need. So that's the only catch to that. So, okay, I think that's all the questions there.
Mark,
we got it. So yes.
There was actually one that came in multiple times when I was reading through them. A lot of people are confused about what has to be spent by the end of this month.
We're going to talk about that later on. That's going to be the bulk of my presentation. So okay. Let's go ahead and thank you, Shannon and Elizabeth. We'll give the floor to you, and if you would update everybody on the grant applications. I know it sounds like when we first started this, talking about it about 3 or 4 weeks ago, Elizabeth was saying, yeah, it's going to be a pretty easy month. I only got 3 or 4 of these things signed up, and now not so much. It's about 40 or more. So Elizabeth, give us a little update and sort of let us know how that's going and what we need to do to make sure everybody gets at least 50,000 and hopefully more.
Yes, thank you. So first of all, I want to say you can do it. I've had a lot of emails that are panicking, something's not working right. Here's some things that you can do to help troubleshoot those. So I just kind of want to review the steps. First of all, know that you can do it. HRSA wants you to do it. The National Association of Rural Health Clinics and State Office of Rural Health wants you to do it. So let's make sure that we do that. I've already had quite a few people say it's not even worth it, I'm not going to do it, and they've written it off for whatever reason. So know that there's a good chance there may be more funding available. You might be able to get, you could get less than 50,000, but I would say there's a good shot. And even in talking to some others today, agreeing at the national level that probably could get more. So please take your time to do it. If you have not signed up for sam.gov, again, sam.gov, don't pay anyone. I said this last time and I've got people sending me, I paid $595. Why don't I have my SAM? Please don't pay anyone. It should be free. Go on SAM and register. I know they are saying it's going to take up to 2 weeks. I've had quite a few people taking 2 to 3 days. So go register, get all your SAM done today if you have not done it. Do it before midnight today. Then if you have already done it and you're waiting for the email, sometimes emails go to trash, go to spam, get filtered out with our email filtering systems because it's a government email that you've probably never received before. You can log into SAM and look and see if you're active. If you are active, it's time to start your grants.gov. Keep in mind, grants.gov is a 3-step process to get properly registered. First step is you register yourself and your organization. And that is through the register link at the top right corner on grants.gov or through Get Registered Now link. The second step is you need to log in as the eBiz point of contact, and that would have to match the sam.gov. A trick of that is if you haven't set it up, you can click Forgot My Password on eBiz, click Log in as eBiz point of contact, click Forgot My Password, put in your DUNS. It confuses people because it says UEI, but they're converting to UEI, but they're still using your DUNS. So if you don't have your UEI, your unique whatever identifier, you can put in your DUNS number and your email. You should get a temporary code put to your email. You put that back in and you can get set up as the eBiz point of contact. Now listen carefully. This is the trick. Go to a different computer or clear your browser history at this point. So you log out as the eBiz point of contact, clear your grants.gov browser history, or go to a different computer. You may need to wait an hour or two because sometimes the SAM has to, they have to do an update on the back end. I'm not a computer guru, so I don't know, but SAM has to tell grants.gov, yes, you're the proper eBiz point of contact. Then re-log in as yourself with that initial username and password that you set up. Then search for the grants in the top right corner, search RHC Vax or just RHC, it'll pop up. You click on it. Hopefully then you have a red button that says apply. If it's grayed out, you might want to wait another hour and retry, see if it updates on the back end. If it's still grayed out, you may have to call grants.gov and see what's going on. If it's red, you click the red apply button. And then from there, you are set up. If you need to add another user, or if I'm writing it for you, then you can click participants and add other people to your workspace. From there, you should be able to update everything. I do want to say I've gotten some answers from HRSA and talking to some other consultants at a real in-person conference that I was at, which is pretty exciting the past couple of days to actually see people in person and catch up. And a couple of things is if you do not have your CCN number, in other words, if you are a new RHC, you can still apply, but you need your certificate from your accrediting body, from the compliance team or Quad A. So you would need that, and you would need to attach that with attachment 1. Also, if you are having SAM issues, and my source for this was Nathan Ball at the National Association of Rural Health Clinics. He tells me in the FAQs, it says that if people are still having issues with sam.gov, on June 20th, they can request grants.gov to ask SAM to expedite the approval. But that cannot happen until June 20th. You're going to tell me, Elizabeth, that's a Sunday. It's Father's Day. Guess what? Grants.gov is open 24/7, 365. Just like Shannon, Mark, myself, we respond to stuff 24/7. I don't work on Christmas, so I'm only 364, but pretty much otherwise I do. So please know that they will respond, they will answer. So if you still don't have your SAM, if you're still not set up, make sure you call by Sunday. If you don't make those, if you don't reach out, then you can't ask for exceptions. So make sure you get all that set up. Make sure you do all your attachments, your attachment 1 with your eligibility information, your project narrative, your budget. I've had a lot of people saying on the budget, asking a lot of questions. I really don't want to get into the minutia of that today because we could have a 2-hour webinar just about how to spend that money. But please know this is the most flexible money that you will get. So keep in mind health education, health outreach, any kind of vaccination confidence. It is very vague as you start looking. You're in a way being paid to market yourself and your services as an RHC. So please take advantage of that. They give you a lot of different examples. I've had a lot of questions, and this is where Nathan Ball and I do disagree, and he said that in a presentation today, so I can say it in a presentation. Incentives are, to me, a little murkier. They are low risk, but they are not one of the examples that HRSA provides. So I'm not saying you can't do incentives. I'm saying I try to stick to the work plan HRSA provides as closely as possible. Keep in mind, it is due 1 week from today at 11:59 Eastern Daylight Time. Keep in mind, they don't care what time zone you're in. I've had grantees try that, trying to submit at 11:01 Central Time. Guess what? You've missed the boat. It will literally knock you out. So please get those submitted as soon as possible. I know I've had some clients submit already, so really excited about that. So, if you can submit, go ahead with that. And I think that's all I have. Thanks for inviting me, Mark.
Elizabeth, thank you so much. And thank you for what you've been doing for all of our RHCs. I know you've taken on quite a load for this last month and getting everybody up and going, because all these rural health clinics have never applied for grants before. And it is nice to have somebody to lead them through this process that's been there many, many times. So we appreciate that.
One other thing too, I did get additional information about the USDA grant I referenced last time. That's going to be coming out in early August, and that was from official USDA representative. So the money for construction facilities and infrastructure would be in early August, and I'm sure I can coordinate with Mark to get a webinar then after he gets back from Maine and has all his cost reports submitted. So we'll be in touch about that. But I have been getting quite a few emails about that. So there's your free advice for today.
Okay, all right. And even if we are keeping score, I think it's Elizabeth and Shannon say do not use the incentives or whatever, while Nathan says 2. So I guess it's 2-1. So the guys lose again, I guess. So okay. And then Danny, have you found some questions through here for Elizabeth before we send her on her way to the closest Starbucks or wherever she's headed off to?
No, there's none that came in for that.
Okay, there's nothing specific to that. Okay, well, very good. All right, we are good to go there then. Thank you, Elizabeth. Thank you, Shannon. Shannon, if you leave before I can get back to it, yeah, you've got 2 minutes to get to your next thing. So thank you, guys, and I'll do the provider relief reporting stuff, and Julie will hang with me for a little while. We finally got some information the other day, July 11th, after waiting for a long, long time. For this is the provider relief funding reporting piece that was supposed to go active January 15th, 2021. And basically, when we had a change of administrations, all the stuff that was going on before January 15th, it just stopped because we got a new president going in. A couple of, I guess, 5 or 6 days later, so January the 21st was the inauguration. So, and this is narrative. It's what we heard in 2020 was when they announced this was you can get all this money, $30 billion in grants with no strings attached. Well, we all know that wasn't really true. And in the narrative that we're hearing now is that they're going to come down with a sledgehammer on us. And so I don't think that's really true either. So the reality is somewhere between these two statements here. And we basically, as consultants, we just try to be as conservative as we can with our advice so we can protect you guys from either one of these situations here. So And when this stuff came out on July 11th, I don't think anybody was happy with it. It sounded good. It sounded like we were going to get a lot more time to spend this money. The reality was, for most rural health clinics, is we don't really get that much more time to spend it. June 30th will be the date that we need to account for this money one way or the other. And that's one reason why we're having this webinar right now. I know I really didn't have time to do it now with cost reports going on, but I knew you guys needed to have some type of plan as soon as possible to account for these funds, to figure out where you stand as far as you guys, if you're going to hold on this money, or when you try to report this money. The reporting portal is going to open up from July 1, and you have until September 30th to report. So you got 90 days from July 1st to report these funds for phase 1 distributions. And we'll talk about what phase 1 distributions are just in a minute when we get to that. But Carrie from the National Association or the National Rural Health Association is trying to intervene to where we can get that the June 30th deadline moved back. That's going to be extremely important for our rural health clinics. And then also they want to modify the reporting requirements for cost-based providers such as COS, RHCs, and FQHCs, because I can tell you right now, our independent RHCs, the cost-based reimbursement piece of it, it's sort of annoying, but most of the good thing about our RHCs being underpaid by Medicare for all those years is that we've got a lot of cushion to what that's unreimbursed by Medicare. And when we've been filling our cost reports out, and I don't know if Julie's been seeing this or not, but it seemed like our cost per visits have been going up by close to $25, $30 a visit, just because our visit counts went a lot of them went down, and our cost pretty much went up. Julie, is that what you've been seeing, or is it there's something close to that?
Exactly. And most of it's due to the volume decreases, or the volume that was siphoned to telehealth.
Yeah.
That is paid differently, of course.
Yeah. So what's been happening is our cost per visits have been going up. So, and I'm going to show you an example where we're in 2020, Medicare is only paying our independent RHCs $86.31, but our cost per visit is now $118, $120, $130. Well, there's $25, $30 difference there that we're losing on every Medicare patient, and that's not reimbursed anywhere else. That's unreimbursed, and we can use, the way I'm reading it, and Julie can correct me if I'm wrong, the way I'm reading it is that's unreimbursed, and these provider relief funds can be used we can use that as credit towards keeping these funds. So we'll go through this some more, but hopefully there'll be some changes on this June 30 deadline, because that is really, we don't have a lot of time. So here's the actual press release that came out on Friday. They always tell you this stuff on Friday when everybody's going home and not working anymore, except for us people that work 364 days a year. Then, you know, that's for some reason, that's when they released them on Friday. So there's the press release announcing this, and some of the key updates for this was again, payments for phase 1 had to be spent by June 30, 2021. And then they separated into 4 different phases where the timing was relaxed a little bit. Basically, they relaxed the timing by 6 months for each phase. And so that sounded really good, except for our rural health clinics. Like I said, we got all our money basically in phase 1. So we're still stuck with, we now have, 16 days to account for this money. So if you got less than $10,000 in aggregate, then you don't have to report. But if you do have more than 10,000, which is going to be all of you guys, I know I saw a question in there from Judy saying, well, I got one payment that was less than 10,000. I don't have to report that. No, yes, you do have to report it because you got another payment that was 147,000 or whatever. So you'll need to report those general distributions that were lower. All RHCs, if you're an RHC last year on May the 6th, you received a check for $103,000 plus 1.97% of your expenses. So a lot of RHCs got $200,000 or $300,000 checks that time. So that money will count. And those smaller general distribution checks that you got, you need to add that to the money that you're reporting, because it is an aggregate total. So we have 90 days to report, so we have till September 3rd, which that is good news, because I was real worried the initial time frame was only 30 days to report from the time they opened the portal. That was going to be a complete nightmare. And again, the portal's it's not open yet for you guys to submit your information. It opens July 1st. So, which is really, that's sort of annoying too, because that's after we have to have all the money spent. I mean, it would be certainly nice if we could go into the portal before, figure out how it works, and then figure out how to spend that money for it where it works, but that's not the case. So here's the reporting periods. Period 1, I call them phase, but period 1 is from April 10th through June 30th, 2020. Like I said, this is where you guys got most of the money that you received from grant funds from RHCs. And so the deadline for use is June 30th, and then there's our deadline for reporting. If you got any money from July 1 through December 31st, and there was a general distribution, a number 3 that occurred in December, I think it's around December 15th in 2020. Those funds you're going to have to report. You have to spend those by the end of this year, and then you have to report by March 31, 2022. Period 3, period 4 works exactly the same. I haven't seen any distributions. Well, I guess I have. June 3rd. No, the $100,000. Well, the $100,000 that we got is not a provider relief fund. So I haven't seen any distributions that have to be reported as provider relief funds during this period of time. So what you guys need to do is come up with an action plan in these last 14 days. So number 1 is determine the amount of unused funds you have on hand, and as from provider relief funds. And first off, you got to figure out what your provider relief funds, and I've got a table that I'm going to show you next that will help you determine that. So determine how much provider relief funds you do have to figure out what you're going to do with. And the second thing I would do is determine your lost revenue, and HHS uses the calendar year. So what you want to do is look at 2019, what your net patient revenues were, compare that to your net patient revenues in 2020. And if 2020 is much less than 2019, that's what's called lost revenues. Now, I know in the instructions, it says you're supposed to report expenses first and then report your lost revenues second. I like to begin with the end in mind, where I know what my number is, because lost revenue is very easy to compute. It's basically just taking those financials that your accountants give you, and I had a nice, beautiful example of one where they show you the comparative financial, and if you can run a report of comparative financial in QuickBooks very easily, a comparative profit and loss, see what your net patient collections were in 2019 and 2020, and it's a 5-minute check to see what your number is, and you can see if you're in really good shape or you've really got to be digging through your trial balance to keep up with your expenses. And then your third step is dig through those financials and find your expenses directly related to COVID-19. Now, if you were on top of things, I've got a couple of you guys that I talked to Deb yesterday, and Shannon posted on Facebook that they have done, that they kept up with everything and they know where everything was. And so we've got probably a few of you guys that are like that, but most of the rural health clinics that we work with are relatively small, and a lot of you guys don't have the greatest accounting systems in the world. And you got 3, 4, 5 employees. It's hard to have a sort of a full-time accountant working on stuff like this. So if you haven't done anything, what I've seen on doing cost reports is you look at their trial balance or their balance sheet, and they're sitting there with that $103,000 check in a savings account as of December 31st when we're looking at these cost reports. So that tells me they haven't spent any of that money. They probably still haven't spent any of that money. But you now have to do something in the next 14 days in order to hang on to that money. And what I would do, Julie and I, this is our first rodeo on something like this. I know if you ask us about cost reports, you're like, oh yeah, I can go back to working on cost reports in 1981. That's when I first started on cost reports. Julie, I don't even know if she's even born yet, but she's been working on them not since 81, but a long, long time as well. So
94, Mark, 94.
94. So she's been going back to 94 doing cost reports. We have never done one of these types of things. This is our first pandemic. But what I would do is try to keep a good accounting system and have a paper. I think of it like, I know Myers and Stauffer in Kentucky, we do a lot of those Kentucky Myers and Stauffer cost reports, and they audit you to death. I would think of it like that. Like, you're going to get audited to death, so we need to have paper trails of where we spent this money. If you put that money in a savings account, what you're going to need to do between now and June 30th is write a check and document on that what that check is for. Just like you did with most of you guys did do pretty good on your PPP loans, where you put in a separate account and then pulled it out and then you reported it. I did the same thing with our PPP loan. And what you want to do with this is document, create that paper trail to where if you do get audited, you'll have something. Most of our clinics will not have to report in a lot of detail. Basically, you're going to report two numbers, a general number and a healthcare related number for your expenses. That's all HHS is asking for if you receive less than $500,000. So you don't have to do a lot, but I would seek out, talk to the Julies of the world, talk to anybody that's pretty familiar with this. Chris, I think Chris Christopherson with HSA Group has been working on this a lot. So reach out to your professional advisors and help you with this. But do remember, you only have 14 days. That's why we're doing this webinar today, is because your time is running out. So here is my little table that what we did, Nathan put together this table here, and I've been using it to sort of keep up with all the distribution. So, and again, Nathan Baugh, my traffic cop days, a lot of stuff goes to Nathan Baugh as well. And he's been extremely helpful in responding to everybody as well. So our period one here, this is the red period, because it is red for us. We got to go and get this done. So period covered 4/10/20 through 6/30/20. If you received money during that time period, and when I sort of put Nathan's table up to this, I'm like, okay, April 10th, we got 6.2% of our Medicare reimbursement. That was the first general distribution. We got another one basically 2 weeks later. Now these dates may not be exact. You may have not got the money exactly on these dates, but it's pretty close. And then we got that beautiful May 6th, 2020, the day everybody was screaming for joy. We got 103,000 plus 3, I said 1.9, okay, 3.6 of operating expenses. It was a lot of money. It was a lot of money that we got. That's gonna have to be spent by this June 30th. So you got these two distributions, April 10th, April 24th, and May the 6th. Now, notice that 49,000, this is not a part of the provider relief funds. That's when you report that to Nathan and Shannon's website there, National Association of Rural Influence website, which is fantastic, very easy. I wish this portal was that way. So this is what we're worried about right now, what we have to cover by June the 30th. And then period two, we did have that one payment there that came in 12/15/2020. We'll have to report that. Like I said, I haven't seen any payments period three, and we're not in period four yet, so we haven't seen any yet, but we may be getting some in the near future. So that's my that's the sort of the table. We put them together. That should help you to understand what you're dealing with in the very near future here. Again, you don't put the lab testing things in there. That's a FAQ that I'm just putting there. Oh, there's the website. When somebody asked about that, and I think Shannon had put it in the chat over here. If you're going to report for your laboratory, go ahead and make sure you get on that and register, because you can't get that $100,000 until you register and get your reporting done on this website, as well as the Q Core thing as well. So you want to make sure you do that. Here is the reporting. This is the web page where if you click on here, this came out on June 11th. And this just tells you what I've just told you as far as the periods. And I think I've told you most stuff that's on there. Let's see here. Period of availability, time periods. Again, what can you spend it for? You must use payments for eligible expenses included services rendered, lost revenues. You have basically 12 months to spend the funds. Unfortunately, we're at that 12-month time frame, as we've told you before, and this basically tells you what you can use it for. HRSA has promised some technical assistance webinars, but a little bit of, I guess, German Coast Guard comedy, Mayday, Mayday, we are sinking. What are you thinking about? That was terrible, but I thought it was sort of funny yesterday. I think it was one of those 3 o'clock mornings or nights. So by the time we get this technical assistance, it's going to be too late for a lot of you guys, which is again another reason why we're doing this webinar today. Here is the final version. Again, put that in parentheses because this is I think the 6th version of the final reporting requirements that we have seen. The key takeaways is it's gone from 6 to 11 pages. Unfortunately, a part of those 11 pages was the nursing home infection control program became a part of it, and they put a lot of information on nursing home infection control, which made it so confusing. It's just like chapter 13 of the Medicare manual, where rural health clinics and FQHCs are thrown together, and you read that stuff, and everybody will read the FAQs, the FQHC stuff, and think, oh, we can do diabetes management and get paid for it, blah, blah, blah. And you're like, no, that's just FQHCs. Same thing here. This nursing home infection control program is all through this. That's the actual 11 pages that are out there. They did add, there's going to be a survey at the end of your reporting that you're going to have to fill out, and there's a narrative portion that in there that's optional that you should fill out. It's optional. And then there's no changes to lost revenue that I can see on there, and no changes to expenses as well. So that's good. And then let me see here. And then there's the new survey requirements there that are out there. Expenses. I tell you what, Kate, can you do you want to unmute your line real quick? Kate, we've got Kate Hill from the compliance team. It's a good time to stop and let me catch my breath. And Kate, you want to tell everybody about what you guys have going? I know you got some type of grant thing and patient medical home. Go ahead and tell us something, Kate.
Well, it seemed like, so one of the reasons why patient-centered medical home is an obstacle is many times the cost for clinics. And so what we did was we wrote a COVID complete module, which I already ran by Tom Morris. It meets the criteria. So they're going to have the federal government pay for their patient-centered medical home. And we also put together, I sent you a piece that I put together to help them write this grant, because it's the DUNS number is harder than the grant. It's not a normal grant writing, as you know. It's still hard, but not what a grant writer does, like the gal that just was on, who's so wonderful, does. It's pages and pages and weeks of work. This is not that. And he basically told me, I have a meeting with him this afternoon again. He basically told me, unless you're writing gibberish in there, you get the money. And he also said this, listen closely. He said, if you are in there and you are having difficulty getting it to take, if you will, because you get kicked out of your own little space in that thing, apparently, at grants.gov, take screenshots. He went on record and said this yesterday on a call, that I will work with you after June 23rd. So please, at least make the attempt, get in there and try to get it done. Take screenshots to show that you were in there and trying to do it. It's hard. We get that. They know quite well that clinics are not, they're just not used to doing this, especially the independents. My goodness, we need a lot of help. So I put that piece together. I'd be happy if you'd share that. But basically what the program is a COVID PCMH. That's what it comes down to, because it's testing, mitigation, community outreach, vaccination, all that rolled into one. Just one way to spend the money that you can be sure will meet muster, if you will.
Okay. All right. Well, thank you for letting everybody know. Remember to reach out to Kate Hill with the compliance team. And Kate, we certainly appreciate everything you do. You've been so helpful. I know. It seems like when we need you, you've always been there. So it is.
No, I appreciate what you're doing. This is so important, and it's such a challenge and on such a short time frame. He also said there's more coming, so don't miss the boat on this, but you got to have been in there. So that's pretty nice. I've never seen an opportunity like this. I mean, the challenge is what to spend it on right now. We have people buying tents, vehicles, all kinds of things. So
okay, wonderful, wonderful. And I will, Kate, will you send me? It's on the. It's in our Facebook group, your information there. I'll make sure that when I send out my stuff, the recording and the slides tomorrow, I'll make sure to add a link to that as well. So
thank you so much, Mark. Really appreciate what you do.
All right, thank you. Okay, let's go back to the boring stuff now. Expenses. Where can you spend the money? You know, again, they sort of borrow from the emergency preparedness piece that we do, is to prevent, prepare, and respond to coronavirus. I've said that so many. This little slide, I actually even have it in my emergency preparedness table talks that we do with our rural health clinics. So prevent, prepare, and respond. And what I do is I put together a document there, and I'll put this one page. It's a Word document there on what expenses are allowable for the provider relief funds. Here's the big catch, and this is one thing that the National Rural Health Association is that's really a problem, is first, expenses must not be reimbursed by another source, no double dipping. And if you're getting cost-based reimbursed on your hospital cost report, you're a CA, and you're going to claim these expenses, because we're claiming all these expenses on the cost report because there's really no way around doing that. What the provider relief fund instructions say, if that's the case, you've been paid for everything and you have no allowable expenses and you're going to be paying back all this money. That's going to cripple our hospitals. Our hospitals are going to go bankrupt from all this if they're not going to be able to claim this, because they're going to be sending back every single penny of this money. So I know that's one reason why the National Rural Health Association is really fighting to get some of these rules a little bit more relaxed for our rural health clinics. So the expenses are net unreimbursed expense. Again, they go through it right again, attributable to corona, net after any assistance received. And they do want it broken down by quarter, although I know your lost revenue calculation is done on a yearly basis. So we're going to compare 2019 to 2020. And then on page 9 and 10, and remember to get 9 and 10, don't get page 8. Page 8 relates to infection control. I made that mistake just a few minutes ago when I was working on putting this thing together. I was like, wait a minute, this is infection control. This is not what I need. And so pages 9 and 10, and that has a listing of, number one, there's 2 different categories, general and administrative expenses. For most of our people, we just have those 2 numbers, general administration and then healthcare related expenses. Those will be the 2 categories we will just report to HHS. Now, you'll have to break it internally to figure this out. You need to know what's in those numbers. And so pages 9 and 10 will help explain that to you. And then here's a screenshot of a part of page 9. And it tells you, here's what your general and administrative expenses look like. And if you got 500,000 or more, you have to report this to HHS in these different categories. So you guys, if you've larger RHCs, or if you've got more than one RHC, then this would apply to you, where you have to break it down this way. So mortgage and rent, insurance, personnel, fringe benefits, lease payments, utilities, and then other administrative costs. So that's your administrative cost. Again, if you're less than 500,000, you can just dump these into one number when you report that to HHS. And then here's your healthcare related expenses, supplies, equipment, information technology, all that telehealth that we had to do, all the training that you had to do, that's a part of it. And then drop down here, your facilities, all the different, you bought a van, you bought an RV. I saw where somebody had an RV that they parked outside their clinic. You had a tent, all those canopies that we bought, those sort of things, those facilities, that is an allowable expense as well. And then all the different types of expenses. If you have vendors that you're having to pay, maybe telehealth, maybe you had to get Azalea or get somebody to do telehealth for you, and you had to pay them a certain fee to add telehealth. That's the sort of thing that's an allowable expense. Okay, and then the next thing is review the FAQs. They have frequently asked questions out there that explain to you what are some of the allowable expenses. So in this case, here's what I basically did was just copied and pasted some of the FAQs that were out there. So, you know, personnel, hiring bonuses, hazard pay. I know my daughter is doing an MA job this summer, and she had to do a COVID patient yesterday, so it scared us half to death. But it didn't scare her, but it scared me. But hiring bonuses, retention, family care, child care, all these sort of things that you've had to do to hire people, and it's harder and harder to hire people. I know it's been hard to find interns for us as accountants. I can't imagine how hard it would be to hire people in healthcare when you've got this disease that's killed 600,000 people. That's not a job that a whole lot of folks would want. So all those sort of incentives are allowable as a part of this. Outsource third-party vendors, like I said, if you have to hire somebody to help you do this stuff, that is perfectly acceptable there. Again, they talk about not reimbursable by other people. Employees, the problem with employees is most of the stuff is going to be claimed on the cost report as an allowable expense, especially if you're in the hospitals and FQHCs, where most of the stuff is going to be allowable expense on there. That's fully paid, that's fully cost-based. And then fringe benefits associated with this, that's going to be an allowable expense as well. Okay, we're in the home stretch here as far as the presentation goes. Lost revenues. Basically, this was the same question I had last time I did this back in January, and the answers are still the same, all the above. They did not change lost revenue calculations. The easiest and simplest one is just take your actual your 2020 net patient service revenue, compare it to actual 2019 net patient service revenue, and that's going to be very, very simple. It'll take you 5 minutes to do. B is if you've got a budget, which I don't know a whole lot of rural health clinics that I've ever known that do a budget and get it approved ahead of time. Maybe some not-for-profits may have it, but if you did have a budget that was approved by March 26th or earlier, that you could use that and then see any reasonable method for calculating lost revenue. And this comes into play when I know we've got some clinics that maybe they've added providers, or maybe they were in the growth stage, or maybe they just opened and 2020 was much bigger than 2019, but it should have been even bigger than it really was because of COVID. So you can come up with a method. You'll have to justify it. It may come under a little bit more scrutiny, but this is one way that you could do that. So all the above is the way that you can do it. This answer, as far as I can tell, has not changed. And so there's this from the document there that's explaining exactly how it's likelihood of audit by HRSA. This is the any reasonable method there. So all this is still going. Let me see here. That the budget as well. So those are the three ways. So can you use budgeted revenues for computing lost revenues? The answer is yes. There's the FAQ that you have. So when you're actually reporting the funds, the first step is, like I said, I went backwards. I did the lost revenue because it was easy. But what you should do is start with step one, is your expenses attributable to COVID-19 that are unreimbursed. That's the key, unreimbursed. And then add that to your lost revenue. And then that's the amount that you guys can keep. And that's the calculation that you need to do now before June 30th, before your time runs out. So you can figure out if there is if you've got some money around to spend, you need to do it before June 30th. Here's your lost revenue calculation. I was working on a cost report the other day, and I was like, oh, this is going to be very easy to show this. So I copied and pasted this from a cost report we're working on. And you can see in 2020, their net patient collections were $539,030. The previous year was $735,000. That variance of $195,495 is lost revenue. So this clinic is in really good shape as far as hanging on to all that money that they received from HHS, because they didn't get $195,000 from them. So that's, again, really, really super simple way to make that calculation. And then here is a calculation that, and this is one of the most annoying things about this process, is these FAQs. they'll be there one day and now they're gone. And this one, I have not seen it. I'm not saying it's not there, but I did not see it this time around. If you are making decisions and relying on them, I think like what Kate talked about, doing a screenshot, take a screenshot of any type of FAQ that HHS has, because they're notorious now for pulling them off and not telling you that one time we told you you could do this and not. But so in this case here, they came up with a method that talked about computing what your average cost per visit is, and then comparing it to what you were getting paid. And if what you're getting paid is less than that, then you can claim that on as your provider relief fund. So that's what we're doing with this example that we're going to have for you right now. Then this is an actual example of a real clinic. The great thing about working on cost reports now is I get lots of this information in my hands. So in this case here, we had a targeted distribution of $166,000 in May the 20th, and we had phase 1 and phase 2 distributions in that same period that totaled 13 grand. So we had total period 1 provider relief funds of $179,000. Well, first thing I did, I cheated. I went to lost revenues and I looked at the same type of numbers that I looked at just on the last slide there. And it showed that in 2019, they had net patient revenues of 1.7 million. 2020, it was 1.6 million. So we had 104,000 of lost revenue. So, okay, that's my number I'm shooting for. Next thing I did was I did my cost report, and my cost per visit it shot up from $86 last year to $118.44 in 2020. It increased by $29.58 per visit. I'm attributing that big part of that is due to COVID-19, having less visits, and in general, things are just more expensive. And so then I also compared how much of this was unreimbursed. And when I computed unreimbursed, I said, okay, we had $118.44 of my cost per visit. Same. My cap in 2020 for Medicare was $86.31. So we had unreimbursed Medicare cost per visit of $32.13. The way I computed my actual cost went up by $29.58. I took the lesser of the two, being conservative here. I said I used the lesser of that, and then I multiplied that by my number of Medicare visits. That gave me $74,482. I add that to my lost revenue, and we only have $976 not accounted for. And I can do that same process to my Medicaid patients. I know their Medicaid patients, I think they pay them $87.42 a visit in their particular state that they're in. So I know that my cost is 118 minus 87 times the number of Medicaid visits, which are astronomical. We're well over that number, and we're going to be able to keep all of our money that way. And you can do that to every payer until you use that money up. So this example worked really well. Julie, you had a question?
Well, I was just actually going to make a comment before you move on from this fantastic example. I just want to pull this into cost reporting and rates for just a second and put a caution out there for everybody. Let's just say this is you. This is your example. And your cost per visit this year came out to be 118, but your cost per visit normally sits around $89, okay? If you expect 2021, 2022 to go back to that $90, $93 level, but your MAC's going to look at this cost report and say they've supported $100 per visit. Let's bump them up. They've supported next year $113 per visit. If you cannot sustain that cost per visit, you're going to owe Medicare back on your 2021 and your 2022 cost report. Medicare is going to raise you to what this 2020 cost report said, 100 into 113. But if that's not reality for you in 2021 and 2022, you're going to owe money back. Following me, Mark?
I follow you. I hadn't thought about that, but you're absolutely right. That's going to be painful when that happens.
People. Yes, just know if you normally run 90-95, and because of 2020's levels, your rate got jacked up. If you don't sustain that and you can't support it, you're going to owe money back.
Yeah, that makes a lot of, thanks Julie, that makes a lot of sense. So this actually works out real well for 2020 for provider relief fund reporting, but yeah, I think that's a very good cautionary tale actually. So okay, let's move on now. I think that's everything I had on that. And then here are the FAQs that HHS has put out. Go through those. Like I said, read those closely. If you like one of them, you know, what's that old Beyonce song? Put a ring on it. Take a screenshot of it if you like it, because it may be changing. So, but use that. CMS has 174 pages of FAQs. I printed these off for you just so you can have those as a part of this. I'm not going to go through and read all these to you, but these are, I just took the ones that related to expenses. So, and there's a lot. But it says pretty much very clearly, I don't know if it's very clearly, but it's clear that we can claim all these expenses on our cost report. Where we run into problem though is claiming all these expenses that we put on the cost report as a provider relief funds use. That's where you're going to run into trouble, because it may or may not be allowable for you to do that, to put that on the provider relief fund portal, because you've been reimbursed by another source, and that's where your hospital is going to run into issues, especially the cost. They put this on their cost report. It's been reimbursed by Medicare. Medicare has fully paid them 101% of cost, and when you try to put that on the provider relief funds, you've not met this, you know, this payer of last resort thing. So I think that's something that the National Rural Health Association is working through and trying to make sure that we don't have a landmine here for all of our hospitals. And I know a lot of lawyers that I've talked to have said the same thing. They're just like, I don't think this is going to work. So and then here's they make a good example of this too. Here, they're showing all the personnel costs that you have. Do remember, you can't claim over 197,300 in 2020. That's the cap for your salary for provider relief funds. In this case here, we had total expenses of 1.5 million. We had a FEMA reimbursement of 50 grand. Maybe we were reimbursed on the cost report for $1 million of it. Then we had eligible PRF funds of 477,000 that we can draw down, and they're showing, you know, where they're taking that money against that. So that's a good example of this. Capital equipment, everybody wants to buy buildings and equipment that lasts for a long time, and if it was specific like a ventilator, then you can probably be okay with that. But if you're just buying a physician practice, they're not going to let you do that. So you just be very careful on your capital expenditures. Talk to your attorneys, talk to your people that are very knowledgeable of that. And when you're doing capital equipment, don't be going out buying buildings without talking to somebody about that. And here's another one on capital about retrofitting. If you're putting in new HVAC systems that have negative pressure units and COVID-19 stuff and changing out your ICUs, that's perfectly acceptable, but some of the other stuff would not work. And I'm going to skip through all of these because we are running out of time here. We're way over an hour at this point. This one is important though. You do have to pay taxes on these provider relief funds, so that additional tax burden is a use of your funds. So on your June 30 distribution here, if you need some money, this is a way to pick it up, is doing that. So you look at your tax return, figure out how much tax you had to pay without provider relief funds, then add the provider relief funds to it, and whatever that difference is, take that from your provider relief funds if you haven't used it up already. Hiring and vendor costs, hazard pay, that was an allowable expense. Questions, Danny, can we do a few of these? We'll probably go, let's just go a few more minutes here because I know everybody's got other things to do.
Okay. I'm going to focus on the ones that deal with lost revenue.
Yep.
That was what a bulk of them were.
Yep.
Let me scroll through and find them. I wrote the names down.
Okay.
One of them was when they're looking at lost revenue, do you have to include, and I know you covered this, but it came in multiple times, so I wanted you to reiterate, do they have to include the funds that they've received in part of the calculation of lost revenue? So like the PRF funds that they got, is that included?
It is not included those PRF funds are not included as a part of the lost revenue calculation. So, which is great. That's great.
All right. What about if we hire?
That's a really good point. I should. Okay, next time I'll put that in the slides. Okay. Write myself a note. Okay, go ahead.
Another one that came in is if we hire 2 extra providers when we calculate the loss of income, the net will be more than last year because we have those 2 extra providers. Is that correct?
Yeah, that's method 3 right there. That's when you want to write up like, yeah, we would have been way up here, but now we're only here. And even though our revenue did go up, our net patient revenue did go up, it should have gone up an extra 200,000, and it didn't. So yeah, that's a good example of using that method 3, where you have a methodology that you describe to them how you came up with it.
Okay, and another one, I guess that would fall in that same category. Can we use Q2 2020 through Q1 2021 versus the same period a year prior for the lost revenue instead of a calendar year?
They are using the calendar year. That's a good question, because I had that same question myself. I was like, wait a minute, the pandemic, it didn't get started until basically second quarter for us. So you right now it's on the calendar basis is what they're using. So unless it changes.
Okay, another one that came in is going to deal a lot with Tennessee. Do I add the wraparound to the patient income when I compare the 2 years?
Yes, I would. In Tennessee, there's a quarterly wrap payment that's a part of your net patient service revenues. If that wrap payment relates to that period of time, then you want to use it. Don't use the monies if they're related to a different period of time. So you want to sort of keep the periods of time in the same quarter.
Okay.
And can I make a quick comment on that? So
yeah.
If you're in a state like Michigan, or in a state where they've determined your wrap a year in advance, and so your wraps are based upon some other volume, and you know they're going to take that money back because you didn't have the volume to support the wrap they gave you, you might want to do a different calculation. For Tennessee, you actually give them concurrent data. There are some states where the data, they fix your wrap a year, back in December as to what your quarterly or monthly wrap payments are going to be every month, and then they true you up at the end of the year. I think South Carolina may do that. You might want to do an alternate method and say, yes, they paid us this, but they're going to take back 25% of it, 30% of it when they recon us annually.
Yeah, and a lot of it too depends on how you should be using accrual basis accounting as a Medicare entity instead of cash basis. So that would be a good time to record that sort of reserve for paying back and then lowering your net patient reserve. Make sure it's reasonable, but that's a good way to do that. Any other questions here?
I mean, there's a lot of other ones. This one kind of goes off your accrual method because Nicole asked, in 2019, their Medicaid payments were being withheld. So they didn't get a huge lump sum until January of 2020. If our 2020 comes out to be more than 2019, how can we explain this?
Yeah, that's the same sort of scenario there. That I would just get it on accrual basis. If it was for 2019, then you make a calculation, putting it in the right year, right calendar year, because we want to have apples and apples. And it sounds like we're definitely getting apples and oranges when you do it that way. Okay. Another question real quick, and then I'll put together answers to the questions that are in the box. So we're not going to have time to do. We have 1 minute left here. I normally don't do this because we can get so many of these, but in this case, this is so important. I will put together answers to all the questions for you guys, and I'll distribute those when I send out the recording tomorrow. I'll put the FAQ. I'll put the answers to the questions you have with that. Julie, thank you for being here. Do you have anything I know I covered a lot today, but I may have missed something. Is there anything you want to add before we send you on your way and send everybody on their way?
Just prayers for everyone as they complete this pandemic and as we come out of it and do all the back end reporting, and prayers for Mark and myself are greatly appreciated as we finish going through cost report season.
Yeah, it has been a crazy 15 months. I'm ready to actually slow down and get away from it for a little bit. So next week I will be in Hilton Head. So that will be nice.
I'll get back to my Mickey Mouse, as everyone knows. So
I'm going to rent that thing from you one of these days. So in fact, we're going down there at Christmas. We need to talk about if it's going to have any availability at Christmas, because I'll come. Judy Quinn has a wonderful place in Orlando, very close to Mickey House there. I guess are y'all renting it out and everything now?
We do.
What's that?
We do rent it out. Yes. We
okay.
do.
All right. Well, good deal. Good. We need to talk about this some close to Christmas. So okay. All right, everybody. Well, thank y'all for attending. We appreciate everything you do, and do stay safe out there. Thank you.
Thank you. Bye.
Bye, everybody.